Let us discuss about back of leg. As you can see in this diagram, this is a posterior compartment of our leg. So mainly this posterior compartment is a bulky compartment and it is made up of our gracilis muscles. Actually the gracilis muscles, this you can see the swellings here. This is due to the bulky two heads of gracilis muscle, and below you'll have the our peripheral heart muscle, that is our soleus. So why we called soleus as peripheral heart? Because its cuff, their cuff are pumping the blood to the heart. Mainly the venous return blood which is going to the heart from the leg is because of pumping of the soleus muscle. Hence we call them as a peripheral heart of our leg. So the two bulky heads of the gracilis muscle form main compartment muscle of back side of our leg, and below you'll have the soleus muscle. And you can see here the different veins. So that veins only take our venous return from the blood, especially from the leg, dorsum of foot towards the heart. So that pumping, because of the soleus muscle pumping, the blood is going, so it is called as peripheral heart. Okay. And one more thing, this popliteus fossa, right? This popliteal fossa is mainly acting like a locked knee joint. So whenever this is locked, whereas a popliteus over there, it is acting as a key of the locked knee joint. Okay, so this is one more important point to remember. And one more thing, all these posterior compartment muscles are inserted to the strongest tendon of the body. That tendon will be situated here, and that name is tendocalcaneus. So to the tendocalcaneus, all this back posterior. So mainly the introduction of this is the backside, the bulkiest muscles, and it is mainly having the two bones. Of course the bones will not change. Of course on the medial side you will have your tibia, and on lateral side you will have your fibula bone. So these two bones will be present over here. And also there are two arteries which are mainly supplying this backside of the leg. The two arteries are the posterior tibial artery and also the peroneal artery. So posterior tibial artery will supply on the medial side of the leg, and the peroneal artery will supply on the lateral side of the leg. Because already our fibula bone, its nerve or its blood vessels all are named as peroneal, right? So the lateral side is supplied by the peroneal artery, medial side is supplied by our posterior tibial artery, because it's posterior side of the leg, so posterior tibial artery. And there is only one nerve in this compartment, that is our tibial nerve, which mainly represents the both medial and ulnar nerves of the forearm. As you know already, in our forearm we have the median and ulnar nerve, but here in the leg, on the posterior compartment of the leg, you have only one nerve, that is a tibial nerve. So these are like, you can see here the posterior cutaneous nerve of thigh. So we'll also now discuss the different cutaneous nerves. Before that, let us start with the superficial fascia. In the superficial fascia, mainly today we are going to discuss about the small saphenous vein, the great saphenous vein, and also we are going to discuss about the different cutaneous nerves supplied to our back of the leg. So first, the small saphenous vein. As you can see here, this is a small saphenous vein which is formed especially in the dorsum of the foot by dorsal venous arch. If you remember in the previous video, I already discussed what is dorsal venous arch. So from that dorsal venous arch, the blood will be going upward, especially by means of the small saphenous vein. This small saphenous vein is going behind the lateral malleosus, right, and it is going laterally to the lateral tendocalcaneus here. Okay, lateral to the tendocalcaneus it will move, and at the popliteal fossa it pierces the deep fascia. Here it will pierce the deep fascia and opens into popliteal vein. So here will be popliteal vein, so here it will open into popliteal vein and drains mainly the lateral side of the foot, heel or dorsum of foot, everything it will drain into the popliteal vein. And this is connected also with the great saphenous vein and also with the deep veins. Okay, and of course it is accompanied by the sural nerve. You can see here it's mentioned, this yellow color one is a sural nerve. So sural nerve is on the lateral side along with our small saphenous vein, whereas on the medial side you will have the great saphenous vein. Along with the great saphenous vein you have our saphenous nerve. You can see here saphenous nerve. So about all this already I discussed. Okay, now once again it's like a just brief idea. So now let's start with our cutaneous nerves. For that we'll switch to other diagram. So here you can see this is a cutaneous nerve, very simple to learn it. Just divide it into the three parts, that is the lateral side, medial side and the central side. Okay, So medial side, central side, lateral side. So just divide into three parts. So let us come from medial to lateral side. So on the medial side, what are the cutaneous nerves supply? On the upper part, if you see the medial cutaneous nerve of thigh. So the thighs nerve only is coming downwards and supplying on the medial side. So medial cutaneous nerve of thigh, especially it is posterior division. Okay, so that is supplying on the upper side of medial side. If you come to the lower side of the medial side, it is supplied by a saphenous nerve. Already I discussed with the great saphenous vein, there is one nerve which is accompanying it on the medial side, that is our saphenous nerve, right? So actually saphenous nerve is a branch from the posterior femoral nerve, right? So saphenous nerve supplies the lower side of a medial side of the leg, and upper side is supplied by the medial cutaneous nerve of thigh, especially its posterior division. Now let us come to the posterior posterior side, middle side, central part. So in the central part, upper side, if you see the central upper part, it is supplied by our posterior cutaneous nerve of thigh. Okay, so I said this one is by medial cutaneous nerve of thigh, this is by posterior cutaneous nerve of thigh. Okay, and lower side it is supplied by the sural nerve. Actually the sural nerve is a branch of the tibial nerve, but this posterior cutaneous nerve of the thigh, it is coming from sacral plexus. Okay, so we have completed central side. On the medial side, upper side you have medial cutaneous nerve of thigh, lower side you will have the saphenous nerve. In the middle part, upper side you will have the posterior cutaneous nerve of thigh, and lower part you will have the sural nerve. Okay, so coming to the lateral side, on the lateral side, upper tip part, the tip part of lateral side is supplied by lateral cutaneous nerve of thigh. Okay, next, in the middle part, it is supplied by lateral cutaneous nerve of calf. Okay, lower to it, it is supplied by sural nerve itself. Okay, and more lower, if you see this one, this is a sural nerve, right? So this is saphenous nerve, this is sural nerve. So sural nerve is on the lateral side, which is accompanying our small saphenous vein, right? So coming to the lowermost part, that is like you can see like towards in the middle of this lateral and medial middle part, it is supplied by medial calcaneal nerve. Why? Because here the calcaneus bone is present, so that area is supplied by medial calcaneal nerve, and in turn it's a branch of tibial nerve. Now once again let us discuss it. Very simple. So all the upper part of the leg is supplied by cutaneous nerves of the thigh. Okay, this one by medial cutaneous nerve of thigh, this is by posterior cutaneous nerve of thigh, this is by lateral cutaneous nerve of thigh. Very simple. So coming to lower side of the leg, lower side, medial side of course by saphenous nerve, middle side by sural nerve, right? And coming to lateral side, lower side by lateral cutaneous nerve of calf, and also peroneal communicating nerve, and also the sural nerve. So like this you can remember, very simple. Now let us discuss its branches, like from which they are coming. If you see the medial cutaneous nerve of thigh, it is posterior division. Posterior cutaneous nerve of thigh is coming from sacral plexus. Lateral cutaneous nerve of calf is branch of common peroneal nerve, and even the peroneal communicating nerve is branch of common peroneal nerve. Saphenous nerve is coming from posterior femoral nerve. Sural nerve is from tibial nerve branch, and the medial calcaneal nerve is branch of tibial nerve. So only one nerve, tibial nerve, two arteries. There is a common peroneal artery and the tibular artery, right? As we discussed before, especially posterior tibial artery, right? So two arteries supply back of leg. There are different cutaneous nerves. Total you can count them. There are 7 cutaneous nerves. Okay, so this forms a superficial fascia. So in another video, let us start discussion on the deep fascia of back of leg, and in that deep fascia we'll also discuss about the flexor retinaculum and everything. Okay.